Hello, my diatribe. It's me again, Nkiruka, your diabetes diva. Welcome to another series of Let's Talk Diabetes with Nkiruka. Today, we're going to be getting on the nerves of diabetes by doing the right thing. So, I'll go further to just explain what I meant by that catchphrase. Generally, the nerves on our feet are the natural alarm warning bells of the whole human body. And in persons living with poorly managed diabetes, these alarm bells will ring on the nerves of the feet. And this is what we popularly call peripheral neuropathy or nerve damage. So, what symptoms should you be looking out for if your diabetes is poorly controlled? So, you look out for symptoms like sharp, tingling, and burning feeling on your feet, and numbness and the reduced ability to feel pain, and decreased ability to feel temperature changes, and having like dry skin on your feet most times. Just check for cracks and infection and some wounds that happen on the feet and don't heal properly. Those are things you should also have to look out for. And changes in your foot structure or shape. You should also look out for that. But this is usually seen in most advanced stages of peripheral neuropathy. So next, I'll be telling you how to get on the nerves of diabetes. This just means you just have to do the right thing. First and foremost, what I always tell everybody, you should always manage your blood sugar levels and keep them on target ranges all the time. And to do this, you have to employ the cardinal rules of diabetes management, which I always say you have to eat right in the right portion, and your meals must be balanced. You have to exercise, and you have to take all your medications as prescribed. So these are like the three cardinal rules for you to have better blood sugar control. And then secondly, for persons who smoke and are living with diabetes, I would advise you quit smoking and also make it a habit to always keep your feet moisturized. But point of note, never moisturize in between your toes because this helps in the buildup of bacteria, which will in turn cause problems for your feet. And also, never walk bare feet, even if your whole house is rugged. You should always have your indoor slipper on or a pair of socks on. And do not soak your feet in hot water. And you should also wear proper fitting shoes. Never wear ill-fitted shoes, like shoes that have pointy faces. They get your feet all cramped up and reduces the circulation of blood, and this in turn impacts negatively on your feet health. And you should always wear shoes that are very comfortable. For me, and most of the podiatrists that manage my situation always advise that you should wear either one size bigger or half size bigger. So it gives your feet enough room to feel comfortable and avoid the cramping up of your toes, which impacts negatively. For me, I have lived with neuropathy for 33 years now, and I had to make personal adjustments to help me better manage and slow the progression. And the first thing I did was to lose weight. I was initially quite on the overweight side, and this really impacted negatively on my foot health. I constantly woke up in the morning with very, very sharp chronic pain, like on a daily basis. And I had to take the bull by the horn and say, no, enough is enough. And my blood sugars then were like up and down, and this impacted negatively on me. So I had to just take that leap forward and lose the weight. And this really, 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 really helped my foot health. So now I can jump out of bed, no pain, nothing. And I also made it a point of habit to always check my feet in the morning and when I get back from work because of the poor sensitivity of the nerves on my feet. Sometimes I have like tiny wee injuries that I never felt when they happened. So I make it a point of note to always check. So this is also a good habit for you to keep. And like I said, my feet love comfortable, soft shoes. So I've made that a point of duty to always have very comfortable shoes on. In events where I have to wear all those fashionable high-heeled shoes, I always make sure I have my sneakers in my bag and don't wear the high-heeled shoes for too long and wear back my normal comfy sneakers. And that helps my foot health as well. And I always make sure my feet are always moisturized. I never, ever, ever leave them dry. They're always well moisturized and tucked away in a nice, cozy socks. So these are things you can do to also improve your foot health, just in case you've had the development of peripheral neuropathy. And I would always advise that you always make all your diabetes routine visits with your healthcare professional, have your feet health checked, and when the feet health is checked, the color, nerve sensitivity, and blood circulation is always checked. So remember, discuss with your healthcare provider if you have any of the symptoms I initially talked about. Like, comment, and subscribe. And don't forget, you hit the notification bell. Thank you, and looking forward to the next session with you guys. Bye.